That's a really great question because a lot of people really don't know the answer to that. And so the key factor is the female age. And so if a woman has been attempting conception for greater than 12 months, then they should seek evaluation. If that woman is over 35, then the evaluation should come about at 6 months of attempting conception without succeeding. And there are other circumstances in which you would see us earlier than that for a fertility evaluation. That would be things like PCOS, irregular periods, endometriosis, or things that affect the function of the ovaries or sperm production.
Why don't you walk us through a first visit?
So the first visit seems kind of scary because it's difficult to talk about these things, but we truly try to make it a relaxed atmosphere. We go through all of the history of the couple, and then we talk about evaluation for 3 things. So the first thing is evaluating the sperm. The second thing is doing some lab tests to evaluate for the eggs. And the third is talking about evaluation for the fallopian tube. So we really individualize all of that evaluation and care and talk to our couples about that in detail.